This video will familiarize you with the characteristics of each vaccine-preventable disease in terms of transmission, occurrence, and incidence in order to appreciate the preventive role of immunization. These are the list of the following VPDs and the vaccines in use to prevent them. Each VPD is described according to its manifestation, transmission, and how each can be treated, controlled, prevented, and eliminated. Tuberculosis. It is caused by the bacterium Mycobacterium tuberculosis. It usually attacks the lungs, but other parts of the body can also be affected, including the bones, joints, and the brain. The symptoms of TB include general weakness, weight loss, fever, and night sweats. In pulmonary TB, the symptoms include persistent cough, coughing of blood, and chest pain. In young children, however, the only sign of pulmonary TB may be stunted growth or failure to thrive. TB is spread through the air when a person with disease coughs, spits, or sneezes. Patients with TB requires extensive and long-term care. Many people who do not adhere to their treatment course long enough to be cured becomes resistant to anti-tuberculosis drugs. In response, the DOTS strategy was developed for both treatment and control. Directly observed treatment short course is a standardized short course of chemotherapy. National routine immunization programs use the BCG vaccine to prevent miliary and meningeal TB in the first years of life. BCG does not prevent TB itself and provides little protection against the pulmonary forms. It is not recommended for adults. Hepatitis B is a viral infection of the liver. Acute infection either resolves or progresses to chronic infection, which may lead to cirrhosis or liver cancer several decades later. Symptoms are not usually apparent in infected young people, but the likelihood that an infected child will develop lifelong chronic infection is higher than in the infection occurs in older children or adults. Acute hepatitis B does not often cause symptoms and signs, but when it does, patients experience fatigue, nausea, vomiting, abdominal pain, and jaundice. Chronic hepatitis B patients have signs related to liver failure as the disease progresses. Hepatitis B virus is spread by contact with infected blood and other bodily fluids in various situations. In the Philippines, the hepatitis B virus is most transmitted to children by child-to-child transmission and exposure of babies to maternal blood or the fluids during delivery. The use of contaminated needles and syringes for injection, and in countries where infection occurs later in life, the disease is transmitted through sexual activity, contaminated needles and syringes, and contaminated blood products. There is no specific treatment for acute hepatitis B. While the chronic hepatitis B infection can be treated with medicines including the oral antiviral agents. The hepatitis B vaccine is the mainstay of hepatitis prevention. Poliomyelitis, or the polio. It is a highly infectious disease of the central nervous system caused by three closely related polioviruses, the type 1, 2, and 3. Most children infected by poliovirus may never feel ill. Approximately 5% of the people exposed to any of these viruses have influenza-like symptoms such as fever, loose stools, sore throat, headache, or upset stomach. Some may have pain or stiffness in the neck, back, and legs, and 1% become paralyzed. In paralytic polio, severe muscle pains follow the milder symptoms, and then paralysis develops, usually in the first week of illness. The functions of one or both legs or arms may be lost and may result in difficulty of breathing. Poliovirus is highly communicable. It is spread from person to person by contact with infected feces. People who do not have symptoms may still be carriers and can spread this disease. The incubation period is commonly 7 to 10 days. There is no specific treatment for polio. Treatment consists of supportive, symptomatic care. Polio can be prevented through immunization with oral polio vaccine or the OPV and or inactivated polio vaccine or the IPV. Diphtheria. It is a bacterial infection caused by Corynebacterium diphtheriae. The infection can involve almost any mucous membrane, but the most common sites of infection are the tonsils and pharynx. This type can lead to obstructed breathing and death. In its tonsillar or pharyngeal form, the early symptoms are sore throat, loss of appetite, and slight fever. Within 2 or 3 days, the infection results in the formation of bluish-white or gray membrane that can cover the back of the throat, as seen in the photograph. The membrane may bleed and also cause gagging and difficulty in swallowing and breathing. The incubation period is usually 1 to 5 days. It is transmitted from person to person through close physical and respiratory contact. DAT and antibiotics are prescribed for suspected cases. Infected persons are isolated and contacts are prescribed prophylaxis dose of antibiotics and vaccinated with diphtheria toxoid to prevent additional cases. The most effective way to control diphtheria is to prevent it through immunization of children in their first year of life with 3 doses of the diphtheria vaccine and appropriate booster doses.
Tetanus is caused by bacterium Clostridium tetani. The Clostridium tetani bacilli are present in the soil everywhere. It is the vaccine-preventable disease that is not spread from person to person. A typical picture of the spasm associated with tetanus is the facial expression known as the rhesus sardonicus or the sardonic smile. What are the signs and symptoms of tetanus? Signs and symptoms of tetanus may appear anytime from a few days to several weeks after the tetanus bacteria enters the body through a wound. The bacterium produces a toxin that makes muscle rigid, causes spasms, and makes breathing difficult, resulting in death. The average incubation period is 3 to 21 days. Common signs and symptoms of tetanus are the spasm and stiffness in your jaw, neck, and abdominal muscle. You can also experience difficulty in swallowing, painful body, spasm lasting for several minutes, typically triggered by a minor occurrences such as a draft, loud noise, physical touch, or light. How is tetanus transmitted? Tetanus is not contagious. The disease can occur in any incomplete immunized person when tetanus spores in dirt or ashes enter the body through a break in skin. Cluster of cases are sometimes seen among an immunized population sharing the same risk factors, such as living and working in construction sites. How is tetanus treated? Advanced intensive neonatal care and usage of tetanus immunoglobulin can reduce the cases fatality rate in neonatal tetanus. Recovery from tetanus does not provide immunity. How is neonatal tetanus prevented? Neonatal tetanus can be prevented if the pregnant women receive at least 2 doses of the vaccine, appropriately spaced from the following NIP schedule. Pertussis, also called whooping cough, is a highly contagious acute bacterial disease affecting the respiratory tract. It is caused by the bacteria Bordetella pertussis. What are the signs and symptoms of pertussis? Patients usually present with symptoms similar to common cold: runny nose, watery eyes, sneezing, fever, and a mild cough. The cough worsens to many rapid bursts. At the end of this burst, the typical patient takes in air with a high-pitched whoop. Vomiting and exhaustion often followed after the coughing attacks. The incubation period is 9 to 10 days, range 6 to 20 days. Pertussis transmitted. Pertussis is a drop spread by droplets from the nose and throat that are expelled when an infected person coughs or sneezes. The disease spread easily among susceptible people who live in crowded conditions. How is pertussis treated? Antibiotic like erythromycin may be given to shorten the period of communicability, but they do not cure the disease or even reduce symptoms unless pertussis toxins in the body is eliminated. How is pertussis prevented? The most effective strategy for preventing pertussis requires the timely delivery of 3 doses of vaccine at proper intervals during the child's first year of life. HIV disease. What is HIV disease? Haemophilus influenza type B is a bacterium found commonly in the nose and throats of the children. What are the signs and symptoms of the HIV? The serious diseases caused most frequently by HIV are pneumonia and meningitis. Children with pneumonia can have fever, chills, cough, rapid breathing, and chest wall retraction. Children with meningitis can have fever, headache, sensitivity to light, neck stiffness, and sometimes confusion or altered consciousness. The time between infection with HIV and the appearance of symptoms is between 2 and 10 days. Is Haemophilus influenzae disease transmitted? It is spread from person to person in droplets when sneezing and coughing. Children may be healthy carriers without showing any sign and symptoms of the disease, but they can still infect others. How it is treated. Antibiotics such as ampicillin, cotrimazole, cephalosporin, and chloramphenicol are used for treatment. Drug resistance is now being seen with some antibiotics. How it is prevented. Vaccination of children in the first 6 months of life is the most effective means of controlling invasive disease. HIV vaccine will not prevent meningitis and pneumonia caused by the other types of Haemophilus influenzae or other agents. Pneumococcal disease. Pneumococcal disease is an infection caused by Streptococcus pneumoniae bacterium, also known as the pneumococcus. Infection can result in pneumonia, infection of the blood, bacterial meningitis, or milder forms such as sinusitis and otitis media. What are the signs and symptoms of the pneumococcal disease? As outlined above, Pneumococcus can affect many parts of the body. Symptoms and signs vary depending on the site of infection. Fever, shivering, or chills can occur with all types of pneumococcal disease. Children with pneumonia can present with cough, rapid breathing, chest wall retraction. Older patients may complain of shortness of breath and pain when breathing in and on coughing. Patients with meningitis can present with headaches, sensitivity to light, neck stiffness, convulsion, and sometimes confusion or altered consciousness. Those with those with otitis or sinusitis may have pain and tenderness or discharge from the nose or ears. Pneumococcal disease is being transmitted. Pneumococcal disease is spread from person to person by coughing, sneezing, or close contact. A person can be infected mainly through pneumococci contained in respiratory droplets from people who have the bacteria in their noses and throats. In some groups, up to 70% may be healthy carriers. How it is treated. Pneumococcal disease are treated with antibiotics such as amoxicillin and other new antibiotics such as needed and based on symptoms. In many cases, some commonly used antibiotics are no longer effective since the bacteria has become resistant. How pneumococcal disease is prevented. Pneumococcal disease can be prevented by vaccination. Improving living condition and nutrition can also reduce the risk. Measles is an acute viral infection caused by measles virus. Measles is one of the most contagious diseases of humans. What are the signs and symptoms of measles? Measles is characterized by the presence of high fever and maculopapular rash and associated with 3 Cs, the cough, coryza, and conjunctivitis. Small white spot, or also known as the Koplik spots inside the cheek, is also a sign of measles. The rash usually appears on the face and upper neck. Over a few days, the rash spreads to the body and then to the hand and feet. It is usually resolved in 5 to 6 days. Complications from measles include pneumonia, diarrhea, blindness, meningitis, encephalitis, and SSPE. SSPE rarely occurs as delayed complication several years after measles infection. The incubation period of measles usually lasts 10 to 14 days. Measles transmitted. Measles is extremely infectious. The virus is transmitted through the air by respiratory droplets expelled by infected individuals. How measles is being treated. There is no specific antiviral treatment for measles. Antibiotics should be prescribed only for bacterial ear infection and pneumonia. Supportive care includes general nutrition, support and treatment of dehydration and complication. Vitamin A supplementation reduces the number of deaths from measles. Measles seriously depletes vitamin A in children, making them more susceptible to complication. All children in developing countries diagnosed with measles should receive 2 doses of vitamin A supplement given 24 hours apart. How is measles prevented? Measles vaccination is one of the most preventive measures available. Maintaining coverage above 90% can have a major impact in controlling measles. It is infectious caused by a virus. It is sometimes called infection parotitis, and it primarily affects the salivary glands. Mumps is mostly a mild childhood disease. often affecting children between 5 to 9 years old, but the mumps virus can infect adults as well. When it does, complications are more likely to be serious. What are the signs and symptoms of mumps? Almost one-third of the children infected with mumps virus have no symptoms. If symptoms appear, they usually begin 14 to 21 days after infection. Swelling of the salivary glands just below and in front of the ears is the most prominent symptoms. The swelling may occur on one or both sides of the neck. Other symptoms include pain when swallowing, fever, weakness and tenderness, and swelling in the testicles may also be a symptoms. A person who has mumps can infect others from about 6 days before to about 9 days after swelling in the neck appears. Mumps spread. Mumps virus is present throughout the world. It is spread by airborne droplets released when an infected person sneezes or coughs and by direct contact with infected person. What are the complications of mumps? Complications from mumps are rare, but they can be serious. In men and teenage boys, an inflammatory condition called orchitis may cause swelling and pain in one or both testicles, and sometimes can cause sterility, encephalitis, meningitis, and hearing loss or other rare complications that can occur in people infected at any age. What is the treatment for mumps? There is no specific treatment for mumps. Supportive treatment should be given to relieve the symptoms. How mumps is prevented. Mumps vaccines are highly effective and safe. People who get mumps and recover are thought to have lifelong protection against the virus. Rubella. Rubella is an infection caused by a virus and usually mild in children and adults. Congenital rubella syndrome is an important cause of severe birth defects. When a woman is infected with rubella virus during the first trimester of pregnancy, she has a 90% of passing the virus on her fetus. This can cause the death of the fetus, or it may cause CRS. Deafness is the most common, but CRS can also cause defect in the eyes, heart, and brain.